Hello everyone. Greetings everybody. I am Anuja Purohit from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. Welcome everyone to our special Instagram live session. In this live, we'll be shedding light on a condition that affects millions worldwide. That condition is acne. Acne isn't merely a surface tissue, it can deeply impact one's emotional well being. Beyond the physical blemishes, it can erode self confidence, leading to anxiety, depression, and also social withdrawal. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigmas surrounding acne. And that's why today's live aiming to dispel myths, promote understanding, and empower individuals to seek effective treatments. So, today we are diving into the topic acne management with our skin expert. Whether you are struggling with breakouts yourself or simply curious about maintaining clear, healthy skin, this session promises to be both informative and engaging. So, today we are honored to introduce Dr. Khushboo Mahajan, a renowned expert from Delhi. Dr. Khushboo Mahajan stands as a prominent figure in the field of dermatology, currently serving as a consultant dermatologist at Mahajan Skin Center and Koba Skin Clinic in Delhi. Her illustrious career spans significant roles, including MBBS, MD, senior residency, and senior research associate at Maulana Azad Medical College and Lok Nayak Hospital, and as an associate professor at NDMC Medical College and Hindu Rao Hospital, Delhi. Dr. Mahajan is celebrated for her contributions, recognized with prestigious awards such as the PM Verghese Award and the Professor V.N. Sehgal Award. Her scholarly pursuits are evidenced by over 30 publications and authorship of 5 books, solidifying her reputation as a leading expert in dermatology and academic excellence. Today, we are privileged to have her with us, and she will be sharing insights on acne and its management. We extend our heartfelt gratitude to you, Doctor, for joining us.
Thank you so much, Anuja, and I'm so glad to be here and to answer to your questions. And I hope together we can break some myths about acne.
Of course. So, without any further ado, let's start with today's session. I would like to start the session with a little experience of my own. Whenever I have a party or a family gathering to attend, the day before the celebration or the gathering, I always have very beautiful and clear skin. But on the day of the event, one uninvited companion joins me, and that is acne. And I guess most of the viewers will relate to this. So let's start with the thing: what is acne, and what are the types of acne?
So, acne is basically a inflammatory skin condition. There is some inflammation. So, I'll try to be very, very basic because I know my audience is general population. So, what is acne? So, we have a lot of glands inside our skin, which in layman language we call as oil glands. Because of certain factors which are prevailing inside your body, maybe hormonal changes, attaining puberty, your diet, your lifestyle, these glands they start making much more oil than required. Now the gland expands by making more oil, but these glands are opening through a narrow duct into the skin. Since oil is oil, it will block these ducts because the oil has to flow out. But since the viscosity is more, they cannot flow out through these narrow ducts and these ducts get blocked. Associated with this, there is inflammation which is there, and there is overgrowth of certain microorganisms, some good bacteria and fungus around this duct. Imagine it like a blocked drain in your house. So if there is a blocked drain in the house, what will happen? If you leave it unattended, there will be growth of microbes in it, there will be bacteria and fungus which will grow on it. Same thing happens with skin, and these bacteria and fungus which grow on these ducts, the inflammation which sets in, it causes disruption of this duct, which breaks out as a zit or a pimple that we commonly see. So, this is what basically acne is, an inflammatory skin condition which is caused by blockade of these duct which we call as pilosebaceous duct. As you asked me about the types of acne, so acne can be of various types. Like most commonly, we would see acne in pubertal age group. Once you attain puberty, once you're an adolescent, a teenage acne. However, there is acne which can happen in adulthood also. Like these days, we are seeing a lot of acne happening after the age of 25 or 30, which is called as
Yes.
adult onset acne. We also have childhood acne, which starts much before you have your menarche or puberty that you achieve. Then there are hormonal acne, which are linked to your hormones. There are cosmetic acne, which are induced by the cosmetics that you use. There are certain medicines which can induce acne, called as drug induced acne. For example,
Okay.
patients who are on antitubercular drugs, they can get acne. So, acne is of various types.
Right. So acne can also be a reason, like a side effect of many drugs, I
Yes,
suppose.
absolutely,
Okay.
absolutely.
Yeah. Is there any correlation between acne and specific area of the skin? I mean, specific areas of our face are prone to acne or some particular type of acne.
Absolutely. So, see, first of all, as I told you, acne is blocked ducts. These
Yeah.
ducts are predominantly located on my upper part of the body, which is face. But acne can also happen on upper chest, upper back, and arms because these are also the areas where I have these ducts. So, acne predominantly affects the area which are called as seborrheic areas, which is my face, upper back, chest, arms. Now, we see that a lot of patients have dandruff. If you have a
Hmm.
lot of dandruffs, especially in the age group of like when you start having puberty, 12 to 14 years old kids. So, there the problem will start with dandruff. And if you look at their acne, it would be majorly a forehead acne because this dandruff which is there is because of increased fungus overgrowth. A lot of people believe that dandruff is due to dryness. So let me
Yeah.
clarify here, dandruff is not dryness. So please don't start oiling your hair if you see dandruff. Dandruff is basically a fungus which is growing. And if you oil your hair, you are providing food to that fungus. So you will have more dandruff. That
Yeah.
dandruff sheds on the forehead and then you start getting forehead acne, which is more commonly seen with dandruff. If you have hormonal issues, on the other hand, you have PCOD, you will have acne which is localized to your lower face. The jawline would be predominantly affected.
Right.
So, based on
So
your cause, the site of acne can vary.
okay, right. So, many a times we have acne which are very small in size or which aren't so much painful. And on the other hand, some people have very bad looking acne actually and very painful. And we can see that it is filled with pus or the dead material. Are there any kind of grading of identifying such kind of acne?
Yes, there is. So, based on, as I was explaining you, how does acne happen? Similarly, we have
Mhm.
lesions of acne. So, when my duct gets blocked, I have whiteheads and blackheads. So, a lot of people don't even consider whiteheads and blackheads as acne, but that's the starting point of acne actually. So, that is
Okay.
the time when your duct has just got blocked, and actually, you should start treatment then and there.
Hmm.
When my microbial organisms, my bacteria and fungus will grow on that duct, when the inflammation will come in, then I develop those red wale pimples or those pus wale or painful pimples. So when you have those pus lesions, they are actually overgrowth of microorganisms and
Hmm.
inflammation which has set in. Lot of times people have cysts also. There would be a big swellings that are there. So we
Yes.
grade acne in four grades. In first grade you have just whiteheads and blackheads. In second grade you have mainly red lesions with some pus lesions. In grade 3 you have lot of pus filled lesions, and in grade 4 acne you actually develop cysts of acne, which is the most severe grade of acne.
Right. So, according to these types of acne, what are the different treatment options for them?
So before I move on to the treatment, I would like to inform my audience that a lot of times we straight away jump into treatment without trying to find out why is the acne happening. So a
Yeah.
lot of times you would see patients who would go to a chemist, pick up an anti-acne tube or see an ad and pick an anti-acne. In the ad they show this is an anti-acne tube and they will pick it up. But dear friends, how will you understand what grade you are on? What is your cause? So unless you treat it, just applying a cream would not help. That's my first advice. So always seek help from a qualified dermatologist to first understand the reasons for your acne. Are you having just blocked ducts? Is there a component of inflammation? Is there infection? Then why is your acne happening? Are you having some hormonal issues? Is your diet and lifestyle not okay? Are you using any cosmetic product which is kind of aggravating your acne? So these all things a qualified dermatologist can pick up for you, and maybe just eliminating that problem will help you with your acne. So that is the first step in treating your acne. Then what do you do when you actually develop acne? So when you are in grade 1 acne, when you have just whiteheads, blackheads, something called as topical retinoids help. Now, topical retinoids are a group of drugs which are very good for acne, but again, you should know how to use them, because if overused, they can give rise to dryness, they can give rise to irritation. So you have to use it at night, you have to use very little quantities. And then there are different strengths of retinoids which are available. Depending on what kind of skin you have, we have to use the appropriate concentration. If, on the other hand, you have a lot of pus filled acne, then we would need both oral and topical antibiotics. So, in oral antibiotics, also, there are a lot of antibiotics which are available. Depending on what kind of lesions you have, we have to give you those antibiotics. Then we use topical antibiotics. Now, a lot of times we will hear patients who would come to us and say, we have been applying clindamycin for so long, because people know clindamycin is useful for acne, but it is not the only treatment for acne. And you can even develop resistance to clindamycin if you overuse it. So,
Yeah.
the therapy of the treatment, the duration of the treatment, and combining the treatment options is very important. For example, if you have pustular acne, benzoyl peroxide is a very good agent that can help you. Benzoyl peroxide is again used in different concentrations at different body sites. If you have very severe acne, you've developed cysts, you've developed abscesses, or you have an important event which is coming in, and I want to stop your acne at an early stage, or if you are really depressed about your acne, then we have oral retinoids which we use very commonly. But believe me, oral retinoid should never be taken over the counter. It is only a prescription medicine, and you should take it under care of a dermatologist. So these are the
Right.
various treatment options which are there. But again, my message here would be, please try to identify the cause of your acne and treat that to get a complete improvement in your acne.
We have a question from one of our viewers. This question is from Pooja. She asks, what should I do if I experience a sudden worsening of my acne?
If you experience a sudden worsening of your acne, again, there has to be a reason for it. What can be the various reasons? Probably you have used a cosmetic product which does not suit you. There are a lot of OTC products which are available which would say they are non-comedogenic, but you really do not know whether all the ingredients are non-comedogenic. So you have to use that. Second thing, you have to look into your diet and lifestyle. If you have been overindulging in your sweets, in your fatty food, if you are going to gym and you're taking a lot of whey proteins, all this can lead to worsening of acne. Third important thing, probably your hormones are playing on your skin. So you have to check your menstrual cycles, you have to see whether your cycles are okay or not. So as I'm again and again saying, first try to find out what can be the cause of acne. Then if you have been traveling and you've been in an area which is very polluted, even pollution can block our ducts and can lead to worsening of acne. Then what do you do if you have worsening of acne? Again, please see a dermatologist. Please try to find out what's going wrong and treat it. Don't use over the counter product. And very important advice, don't go for parlor procedures if you are experiencing sudden worsening of acne. Any parlor procedures like facials or things like that, waxing, can further worsen your acne. If you have no access to a dermatologist, use a gentle cleanser, use a low percentage of benzoyl peroxide and a clindamycin combination to settle your acne, but try to see a dermatologist at the first possible time that is available to you.
So, before jumping on to any conclusion about acne or how they occur, first we need to find the cause behind it, and uh, treating it by ourselves is not advisable. You
Not
should
at all.
seek dermatologist
not
consultation.
not just by yourself. In these times in malls you would see lot of skincare brands who would claim do this, do that, do a derma roller on yourself, do a wash therapy on yourself, and this would help your acne. Believe me, this all can worsen your acne. And these are small points which we do not even realize. We think, oh, we are using
Yes.
skincare product and still my acne is worsening. But a lot of times you're not using the right product. In fact, when we see any acne patients, the first advice we give them is please don't use products over the counter, because you have a sensitive skin, you have an acne prone skin. Some products may actually worsen your acne.
Yeah. Talking about sensitive skin, what to do for acne in sensitive skin?
Again, so if you have sensitive skin, then we are not going to tolerate products like benzoyl peroxide, products like retinoids. We will not be able to do a scrub face wash or a harsher face wash, like you would hear of glycolic acid, salicylic acid face washes which are available. So if you have a sensitive skin, we have to build your skincare routine accordingly. So first of all, we have to use a very gentle skin cleanser for you. Second, a lot of times people believe acne cannot happen in dry skin, but it is quite commonly seen in dry skin also. So your sensitivity is not because per se you have a sensitive skin, but per se because you have been using over drying products to dry your acne, and that leads to sensitivity. So we have to use moisturizers in these cases, which are again very specific for acne patients. Like, we cannot use strong moisturizers. We have to use moisturizers which are very light, which are sometimes lotion based, which do not have a lot of ceramides in it, because that can again clog your pores. So you have to use a gentle face wash, you have to use a gentle moisturizers, and you have to use very mild anti-acne products. If you do this, eventually your sensitivity may go down, and then in gradual terms, we can give you benzoyl peroxide or topical retinoids. But we will always start with a short contact therapy there. We will not give it for overnight applications or long hours application. So a short contact therapy is usually utilized in sensitive skin patients. Also in sensitive skin patients, you should always try out your products first on your forearms before using it on your face. So
A
that is
patch
another,
test.
a patch test kind of a thing. Though it is not 100% effective, but a lot of times it can help you. And again, if you have a sensitive skin with acne, your case is a little more complicated. Please, again, don't use over the counter products. Don't use multani mitti. Don't start scrubbing your fruits and other things on your face, because that will increase your sensitivity.
Many of the people have started daily skincare routine, and I guess by influencing others, I mean they get influenced by internet or the friend who is using such kind of skincare routine. So basic skincare routine contains two major things. One is sunscreen, another is moisturizer. How both of them are useful in acne management? Are they useful, and if yes, how?
Yes. So definitely both of them are useful. But again, as I was saying, there are special moisturizers and special sunscreens which come for sensitive skin patients, for acne prone patients. I would not say that using a moisturizer or sunscreen can abate your acne or can take away your acne. But yes, when I'm treating your acne or when any patient has acne, both moisturizer and sunscreen hold a very important role. Moisturizers help, especially if you have a dry skin. If you have a very oily skin, you usually do not you need a moisturizer. So,
Right.
and if you have a dry skin, sensitive skin, you need a moisturizer, but you need a very very light moisturizer, which is not blocking your ducts. Then, when we use sunscreens and acne-prone patients, we try to use a gel-based sunscreen or a lotion-based sunscreens, which is again not very very hydrating or not blocking your ducts. We start with 30 SPF, but we can go up to 50 SPF also in these patients. Even if I'm treating you for acne and I'm giving you topical retinoids, topical benzoyl peroxide, they are drying to the skin. So in that case, if I add moisturizer, it further helps because it helps me tolerate these products better. So yes, moisturizer and sunscreen should be an important part of your routine. But if you have acne, they will not treat your acne. They are just an adjunct therapy with your acne treatment.
Um, One of our viewers, Swati, has a question. What are the benefits of using a higher SPF like 50 for acne prone skin?
So when we are talking about higher SPF, it's not really needed for acne prone skin. 50 SPF is good enough. It gives you almost 99% protection from sun rays. Now, why do we need sunscreen in acne treatment? One, when I'm giving you benzoyl peroxide, topical retinoids, they are sun sensitizing agents. So using a sunscreen helps me there. Second, if you have acne, you will leave marks of acne. If you have marks and you go out in the sun, these marks becomes further prominent. So you need a sunscreen to protect your marks from acne. Then we do not need a SPF which is higher than 50 for your skin, especially if you have acne prone skin or any other skin. SPF 50 or higher is needed in patients only who have some sense and sun sensitive disorders. Like there are certain patients who are oversensitive to sun and they have certain skin problems which are related to sun exposure. So
Okay.
in them we use higher SPF, but otherwise for acne prone skin, 30 or 50 SPF is good enough.
Right. One more viewer has asked, what should I look for in a sunscreen to ensure it won't clog my pores or worsen my acne?
So it should be a gel based or a lotion based sunscreen, one. And second, you have to take help from a dermatologist because there are lots and lots of ingredients. And for you to figure out that which ingredient will clog my pore or which will not is very difficult.
Right. Firoz has asked a question. He wants to know, should I apply sunscreen before or after my acne treatment products?
So sunscreen should be the last layer on your skin in the morning. It should act like a barrier. So when you first apply your product and then put your sunscreen. Put your sunscreen 30 minutes before you are moving out. Most of the sunscreens nowadays have good 8 hours protection. So the old thing which was there that you need to keep reapplying sunscreen is no longer valid. However, if you are in an environment which is very sweaty, which is very very sunny, it's a good idea to reapply your sunscreen on top of the old layer after 3 to 4 hours.
Right. One more viewer has asked, this question is from Seenu. What are the early signs of acne scarring and how can I address them promptly?
So early signs of acne scarring is if you have inflammatory acne, which is if you have those red papules and you
Yes.
have
Yeah.
pus-filled lesions, those will usually heal with scarring. So if you have, so as I tell my patients, it is much easier to treat acne rather than acne scarring. So don't let your acne go into the scarring stage. And you can prevent that by treating your acne at an early stage. So first sign you see blackheads coming, whiteheads coming, small papules coming, you treat it there, you would not land up in scars.
Uh, you talked about grades of acne, grade 1 to grade 4, the 4 being cyst formation or very painful acne. So, what are the procedures for treatment of acne according to their levels or grades?
Okay, so the procedures are actually not according to levels of grades. The
Okay.
procedures are always an adjunctive treatment. Now, a lot of patients would come to us and they have acne and they would just want procedures. It won't help, believe me. As I'm saying, if I don't treat your cause, your acne would come back again, any procedure being done. However, I will talk about few procedures which are helpful as an adjunctive treatment. For example, if you have whiteheads and blackheads, removal of these whiteheads and blackheads by a qualified doctor, not by a parlor person or a beautician, helps to treat acne at an early stage. So if you have a lot of whiteheads, get it removed by a dermatologist, because what you're doing is you are unclogging the ducts. So if you unclog the ducts, you will not develop papules and pustules. There are certain patients who would have a lot of inflammatory acne, and they would have some event coming in, or their marriage or something like that. In these cases, we need to hasten the treatment. We need to give you quick results. In such cases, peels help us. So there are certain kinds of peels called as black peel, salicylic, they're salicylic acid based peels, which help us in active acne, which we utilize for mainly two purposes. One, to give you quicker results, and second, if you have very severe acne, which we know would take time with the prescribed treatment, then along with the peel, it gives you better results. So that is what you do. Now, at the stage of active acne, this is the only two things that you should be doing. You should not be going for any lasers. You should not be going for any micro needling or derma roller when you have active acne. Those things are utilized once your active acne has subsided to give you a better skin. They basically help in treating post acne pigmentation and scarring. But
Right.
none of this has to be done at home.
Yeah. Related to this, this question is from our viewer Arush. What should I do if I don't see improvement with the prescribed treatment for acne?
Okay. Whenever any qualified dermatologist is treating you for acne, there is one very, very important thing, at least which I counsel to my patients. It is not going to work like magic. In fact, when I start your treatment, in the first month, you might see a little flare. Because what am I trying to do? As I told you, there are blocked ducts. I have to open up those blocked ducts. So when those blocked ducts open up, you might see that your acne is flaring up a bit. But that's just the initial part of the treatment. To get a good control in acne, it takes 2 to 3 months. So you should have that much patience to treat your acne. Then, if still there is no improvement, probably we are missing out on some of the causes. You have probably certain hormonal issues which are running inside, or you're not taking adequate care of your diet and lifestyle. If those parts are also taken care of, then comes the third part, that probably you need some peels or some extra medicines to cover up whatever acne is not getting treated. But if you are taking care of the cause, if you're doing your treatment properly, if you're taking care of diet and lifestyle, in almost, I can assure you, 99.9% of cases, acne will get better.
These days, we see that stress is related to every other problems in our day-to-day life. So,
Yes.
talking about diet and lifestyle, how we should modify our diet or lifestyle to prevent acne or to maintain the
Good skin.
procedures, maintain the good skin after our treatment of acne.
So that's a very good question, and I think the most important question for today. So, believe me, when Anuja said that stress definitely aggravates each and every condition, and acne being one of them. Diet and lifestyle is important. Why? Because if your diet and lifestyle is not good, it would eventually lead to hormonal alterations in your body and give rise to more acne, bad skin, more stress, more poking of acne, and a vicious cycle which will keep going. So, what should you avoid in your diet? In diet, you should avoid a lot of junk food. Junk food would include all kinds of maida based products, all kind of fried products, and outside food. A lot of time we say we eat healthy, but we are mostly eating out. So when we go out, we eat healthy, but that's not possible. If you go out and you're eating out, you cannot be sure about the oil that is being used. You're not sure about the material that is being used. So you should avoid any kind of junk, any fried food, maida based food. You should definitely avoid sugars in all forms. It can be in the form of shakes, ice creams, chocolates, mithais, a cup of tea, or anything like that. And then the most important thing, milk and milk based products. Now, this is something which my patients always raise an eyebrow, especially their parents, when I say that you have
Of
to avoid
course.
milk based products. So, but believe me, if you are a 16-year-old or a 17-year-old, you have grown. Milk was needed for your growth. Now you do not need excess milk to grow. Milk and milk-based products, in fact, can aggravate acne, and you should reduce it. A cup of milk a day is enough for you. But a lot of people, what they will do is they'll take milk, they will take paneer, cheese, kheer, everything. So milk and all milk-based products should be reduced. Sugar should be reduced, fried and maida should be reduced. You should be exercising 1 hour daily. And that exercise can vary from whatever you like, from aerobics to dance to skipping, gym, whatever you want. If you are going to gym and you have active acne, I would advise not to take whey-based proteins. You can take plant-based proteins, do not take whey proteins.
Can acne be infectious?
No, it is not infectious. Infectious in terms, it cannot spread from one person to another.
Okay.
Not
Can it spread to one side to another side on our own face?
Yes, absolutely. But that's not because of the infection being spreading. It is because of inflammation which is going on in the skin. If you don't treat it, that inflammation will increase and spread to other parts of the body. But it is not, we tell you not to touch acne because, not because it is infectious, but because if you touch or poke acne, you are going to leave a mark, and that mark will be more difficult to treat. So that is the reason you should not poke or scratch your acne, because it increases your chances of getting scars and marks, but it is not per se infectious in nature.
One more question. People like me who are having a profession where makeup, applying
Is very
daily makeup is necessary, or some people are, they get habituated to apply a little makeup every day. Uh, can makeup worsen acne, or what are the treatment products? What are the products which can be used with makeup to avoid acne production?
great. So, one, makeup, not necessarily. Wrong makeup, yes, it can worsen acne. So, the best way to judge your makeup is use it and see it. If you feel that you've started a new product and within 2 to 3 weeks of starting that product, your zits are increasing or you're developing some whiteheads, blackheads, you know that product is not for you. Okay, use standard quality products like good brands. Don't use products which have expired, which have oxidized, or in which while using the product you will realize sometimes a dry powder forms or the color of the product changes. So don't use those
Yes.
products. So, and choose your makeup wisely. I mean, don't go in for whatever you see, like, okay, today I'm using this brand, tomorrow I'm using this brand. If a brand has suited you, stick to that brand. You know that brand suits you. So you would be able to judge, because once you use those cosmetics, you would realize that I'm not getting any acne or anything. The second important thing, there are a lot of barrier creams which are available, which are creams which you apply on your face and then use makeup. So they would not clog your pores. Then use your sunscreen and then do makeup on top of it. So sunscreen again acts as a barrier and can help you prevent any acne. Then there are tinted sunscreens which are available, which I prescribe to a lot of my patients who have profession like you. So tinted sunscreens have iron oxide. They have a little tint in them. When you use them, it gives you a base foundation effect. You do not need an extra foundation, and that iron oxide in the sunscreen is adding an extra sun protection factor to you. So you have a double advantage of doing that. So
Right.
yes, can use makeup, and a lot of people need makeup, and it gives them a feel good feeling also. You can use it for that also, but choose your makeup wisely and use a barrier cream. Don't just directly apply makeup on your face.
Right.
And very important thing, please wash off your makeup before going to bed. Don't leave it for the
Ab-
morning. Yes.
Uh, are there any sunscreen which can be applied over the makeup?
You can, there are like spray sunscreens which are available now. There are roll on sunscreens which are available now. You can spray them over your makeup.
Okay, right.
But it's
And
always better to first and then do makeup.
right, okay. Now, if I had acne, I got them treated. Now, to maintain that good skin, what steps should I take, or what changes should I make in my day-to-day life, or skincare routine, or anything that can maintain good healthy skin free of acne?
Absolutely. So whenever we are discharging an acne patient from our services, like we say, okay, your acne is cured, we always tell them that you need to maintain your skin. And when we talk about maintenance, everything comes into play. For example, if you've got your acne treated and now you're again indulging in your diet and lifestyle, you're not eating good food, your acne can come back again because your hormones are always going to be there. So, one, maintaining a healthy diet and lifestyle is a key to maintaining a healthy skin. And when I say healthy diet and lifestyle, as I said, exercising daily in your diet include lots and lots of fruits and veggies, and less of, again, sweets, junk, maida, and carbonated drinks, less of these snacking, which is very common with the kids, no late night eating, because all this affect your diet and lifestyle, affect your hormones. So you should take good amount of fruits, you should take veggies, you should take supplements, you can take antioxidants. This all help to maintain your skin. Then, in your skincare routine, you should moisturize, you should use a sunscreen, you should use a night serum on a regular basis. And if you have left some acne scars or pigmentation, then there are depigmenting or anti scarring creams which are available, which you can use on your skin both in the morning and at night.
Okay. So, are there any specific types of sunscreen or moisturizers that should be used for acne?
So there are a lot of them in the market. So you can use, as I said, all gel-based, lotion-based sunscreens can be used for your skin type. It can be the moisturizer also. You should use a light moisturizer, which does not feel very sticky on your face, which feels very light. So a best way to judge is you apply the moisturizer and you feel that your skin is hydrated, but you do not feel sticky. You do not feel as if I don't want to apply it anymore. So that's a good
Right.
way to judge your moisturizer and sunscreen.
Should we look for any specific content in sunscreen or moisturizer that is harmful to our skin and should not use that product?
So no, it is not like you have to look into something which is harmful per se. All the skincare products, nothing would be harmful per se. But yes, when you are choosing a sunscreen, especially in adult skin, you should use something which has both physical and chemical blockade. When I say physical blockade, it should have zinc oxide or titanium oxide. And when I say chemical blockade, there are a lot of things which are there, octinoxate and other things which are there, which should be there. So you should look at a combination of both physical and chemical sunscreen.
Right, right. So this is, a lot of information, and some information were really new to me, and of course to my viewers also. And
Sure.
many of our viewers asked many questions, and you addressed them very nicely. And this was a very nice session. I really felt good talking to you. Before
Thank you.
closing our session, any tips and advice for our viewers to maintain a good, healthy skin, or people who are entering into hitting puberty, entering into adolescent, and they must be a little skeptical about, oh, I'll get my acne, I won't look good. So, any tips and advice for them?
Yes, absolutely. So I am sharing what I see every day. This generation is really affected by Instagram with the products which are available. In fact, you won't believe when an adolescent walks into my clinic, sometimes they're carrying a big packet and it has like 5 to 6 skincare products which they have picked up from mall. A friend suggested, someone suggested, and they lay that down on my table and ask me, oh, I'm using all of this, and half
Oh,
of it you do not use. For example, just now I have an adolescent who is using hyaluronic acid, and I asked her, why do you need hyaluronic acid? You have enough in your skin. So the most important advice to this generation is, please don't get swayed by what you see around. There are qualified people to help you out. Your skincare routine need not be complex at all. Don't try to make it complex. It is very, very simple. You have to use simple products. You have good skin when you are 12, when you are 13, when you are 14. We need to just maintain that good skin using very, very basic products. So when, as dermatologists, we try to treat you, we give you products which are very, very mild on your skin and which should take care of your skin. So take Help, if you are worried about your skin, please take help from a qualified dermatologist who would prescribe you appropriate products that would be good for your skin. But just don't keep applying products which are available over the counter or which your friend has applied and probably it's suited. Don't start doing those massages on your face. Don't start doing those derma rollers on your face on your own, because eventually you may harm yourself. So skin is very, very, I would say, if you keep it simple, you would always look good. However, if you try to complicate your skincare routine, you might land up in problems. And
Right.
another important advice at this age, you start going out with your friends, you start eating out a lot, and that is one of the major reasons we are seeing great acne breakouts happening at this age. So try to eat healthy. In fact, if you want a good skin, instead of focusing more on skincare products, focus more on your diet and lifestyle. Play a sport, eat healthy food, and that would do half of your job.
Acne breakouts can also cause some psychosocial anxiety, or people get very apprehensive about their looks and they feel left out, or they do not socialize with people. So psychological effects are also very severe during acne breakouts. So what
One
are
of the
your tips?
lot of times when parents would come to us and we try to treat their child for acne, they would say, "Oh, ये तो चले जाएंगे 18 के बाद क्यों treat करना है?" So this is the exact thing I tell them, that see, your age was different. Nowadays, students or people are conscious. They don't want to step out even if they have one sit. So why not treat them? We have such safe options which are available, and they can be treated. So why to give that psychological depression to a patient when the treatment is simple? So I would say, don't get depressed. There are lots of treatment options which are available. We just get swayed away what I see. Then please treat your acne on when you see the first sign of acne. Don't delay it. Don't think, oh, ये तो age के साथ चले जाएंगे, because believe me, nowadays they do not go with age. With such bad environment that we are living in, such bad food that we are eating, most of the acne now goes on to adulthood. So we need to treat acne. That would be my advice. And believe me, it is treatable. So instead of getting depressed, get on the treatment and you will be all okay.
Any memorable experience of yours, if you want to share with us about treating a person's acne or any skin problem?
So as you rightly was mentioning, it leads to a lot of psychological issues and depression. So there have been few instances when a patient has walked down the clinic crying, and the parents saying that the child is not performing well, the child does not want to meet friends, and all because of acne. So in those cases, more than the treatment, I believe hand holding is very, very important. You have to counsel the patient, you have to walk them down with you with each step. And then there have been instances when those same patients have come on with their friends and saying, "Doctor, now I go out, I meet my friends, and I tell them to get treated." And so I think that's a good job done when you see those patients who are not talking to people now bringing in people. So that's one of the things which kind of encourages me to give treatment to acne patients.
It gives kind of a sense of self satisfaction.
Absolutely, absolutely, yeah.
Yeah. Thank you so much, Dr. Khushboo, for your valuable time. It has been really very informative session for me and for all our viewers, and it is great to hear you. We really look forward for many such
Lovely.
sessions for our viewers in coming time.
Absolutely, and it was lovely talking to you, Anuja.
Thank you so much. And also, thank you all the viewers for your participation for today's session, and stay connected to our beautiful Spotless Skin page. I hope Dr. Khushboo's advice will help every one of you and also me. And okay, so as she said, let's keep our skin care routine simple. And the more normal we act against acne, or the more normally we consider acne, we will be more happy, and we will be free of that psychological stigma. And all the advice Dr. Khushboo has given us, which is very useful. So thank you, everyone. Thank you, doctor. Thank you, viewers, for
Thank
joining
you. It was
us.
lovely talking to you, and it was lovely being here. Take
Thank
care.
you.
Have a good skin. Eat healthy. Stay healthy.
Bye bye.
Bye bye.